Hi, my name is Heather. I'm the nurse that's going to be doing your health assessment. Can you give me your name and your age?
Joel, 30.
Alright. Joel is alert. His speech is clear. No deformities noted. He is sitting in an upright position, slightly slouched. He is attentive. He is smiling. He is well groomed and appears well nourished. Alright, moving on. Looking at his skin overall, I see a little dryness on the legs, a little bit on the arms, maybe a small cut, an old cut on the right arm, and then 2 on the left arm. Moving on now to his head. His head is normal shape, size, appears symmetrical. Alright, and then I'm going to palpate your head, okay? Alright, no bumps or lumps or lesions felt. Moving on, now I'm going to palpate your sinuses. Let me know if you have any discomfort. Any discomfort?
No.
Alright, I'm going to go ahead and have you clench your teeth for me. Good, and stick out your tongue. Good. Alright, now moving on, I'm going to look at his eyes. Looking at his eyes, I don't see any redness or discharge, no real irritation noted. His eyebrows look symmetrical. There is hair there, no missing hair, and he has very good eyelashes, no good distribution. I'm going to pull your eyelids down a little bit here. Alright, they are moist and pink. I'm going to go ahead and look at your eyes here. Good, and they are reactive. Go ahead and I'm going to have you stare at my pen and without moving your head. Good, alright, his eyes are Perla. He's about a 4 to 5. Alright, Joel, you're going to hold this book about 12 inches from your face and cover one eye for me. And go ahead and read that top line of the book.
Get me a blanket. He finally got out.
Alright, and go ahead and switch eyes for me. And read the second line down.
Where's Daddy's truck? I asked, still looking out the window.
Okay, good. Alright, I'll take this from you. Alright, now moving on to his ears. Looking at the ears are symmetrical. I don't see any lesions, no discharge coming from the ears. I'm going to palpate your ear here. Let me know if you have any discomfort. And then the tragus. Any discomfort there?
No.
Alright, other side. Any discomfort?
No.
Now I'm going to look at your nose here. Nose is symmetrical midline down the face. Not noting any bumps or anything. Joel, I'm going to plug one side of your nose if you can breathe in and out for me. Good, and nostrils are patent bilateral. Moving on down to the mouth. His lips don't look dry at all. Good and pink. I don't see any irritation or cracking. I'm going to have you go ahead and just open your mouth real quick for me. Good, okay. Mucosa is pink and moist. And I'm going to go ahead and have you stick your tongue out and say ah for me.
Ah.
Alright. Uvula does move and his tonsils are about a grade 1. Alright, moving on now to his neck. Neck looks good. I'm not seeing any irritation or anything. Alright, Joel, what I'm going to have you do, go ahead and look down for me. Look up all the way to the ceiling. Look left. And then look right. Any discomfort?
No.
Okay, I'm going to put my hand on the side of your head. I want you to push your head against my hand. Good, other side. Good, and now try and lift your shoulders. Good. Alright, strength is equal bilateral. Moving on now to Joel's lymph nodes. I have the post-auricular, pre-auricular, occipital, posterior cervical chain, anterior cervical chain. No, here. Tonsillar, submandibular, submental, and subclavicular. Alright, now looking at Joel's trachea, and I'm going to palpate, okay? Trachea is midline, and I'm going to feel your pulses. Good. Pulses are equal. Now I'm going to inspect, I'm going to go to his posterior chest. Can you just turn a little bit to the side for me? Okay. Looking at the chest, no deformities. His spine does look pretty midline. I'm going to put my hands on your back here, and I want you to just take a deep breath for me. Alright, inspiration is symmetrical. Now I'm going to percuss on your back a little bit. Okay, just relax for me. Good. Okay. Now I'm going to press over your kidneys. Okay, let me know if you have any discomfort. Any discomfort there?
No.
Okay. Next, I'm gonna test your tactile firmitis. So I'm gonna do, every time I put my hand on your back, I want you to say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. Okay. Now I'm gonna take a listen, okay? Alright, go ahead and take deep breaths for me. Okay, good. Alright, moving on to the anterior portion of the chest. No deformities noted, chest looks good. I'm going to take a listen to your breastbones on the front. Go ahead and take some deep breaths. Okay, good. Now noting the chest one more time, I'm going to move on to his heart. Chest does look good. I'm going to listen, or I'm going to palpate for your PMI. Alright, good. Alright, now I'm going to take a listen. I'm going to take one more listen. I'm going to listen with the bell in my stuff. Going on to the upper extremities. Looking at them, they look good. I did note earlier he does have a little dryness. Small cut old scar here, and then 2 pink areas on the left arm. Alright, Joel, what I'm going to have you do, go ahead and lift your arms up in front of you for me. Not to the side. Up over your head. And back down. He does have good range of motion. Any discomfort while doing that?
No.
Alright, I'm going to palpate for your radial pulses. Good, equal bilateral. I'm going to see your hand here. I'm going to look at your cap refill. Hands are warm. Less than 3-second cap refill. Alright, moving on now to your abdomen. So what I'm going to have you do for me, Joel, is go ahead and lay down. Alright, and I'm going to pull your shirt up just a little bit, okay? Alright. Looking at the abdomen, no lesions, no bruises or cuts. He does have a small scar up on the left rib cage a little bit here. No distension though. I'm going to go ahead and take a listen to your bowel sounds. Good bowel sounds. I'm going to percuss now, okay? Good. Alright, and I'm going to palpate, okay? Let me know if you have any discomfort. Light palpation first. And then deeper palpation. Any discomfort there?
No.
I'm going to pull your shirt back down here. Alright, moving on to his lower extremities. He does have a little dryness, a little bit of peeling. Not seeing many scars, maybe a little bit of discoloration here on the left shin though. I'm going to go ahead and feel his pulses on his feet. Do dorsalis pedis first. Good pulses. And then post-tibial. Alright, pulses are equal bilateral. Now I'm going to test the range of motion of his hips. So elevation, flexion, abduct, adduct. Any pain or discomfort?
No.
On to the other side. Elevation, flexion, abduct, adduct. Any discomfort there?
No.
Okay. Alright, Joel. You can go ahead and sit up for me. Alright, so I'm going to test your neurologic now. Okay, so I'm going to have you do, I have this cotton ball here. I'm going to touch you, and I want you to tell me where I'm touching you. You're going to close your eyes for me.
Left cheek, right cheek, right arm, left arm, right forearm, left forearm, right hand, left hand, right leg, left leg, right calf, left shin, left foot, right foot.
Okay, good. You can go ahead and open your eyes. So now I'm going to test your cerebral function. So what you're going to have to do is put your hands out for me. And you're going to pronate, supinate for me. Good, and faster. Good, okay. You can go ahead and stop. Alright, now you're going to take your right heel, and I want you to rub it on your left shin. Good. And the other side for me. Good. Okay. Now I'm going to test his reflexes, starting with his brachial. Go ahead and relax for me. Relax your whole hand. Good. Small reaction, but there's a reaction. Teller. Alright. And then Achilles. Go ahead and relax. Slight reaction. And other side. Good. Alright, now I'm going to do a plantar reflex. Go ahead and relax. Alright, go ahead and stand up for me. Alright, what I'm going to have you do, just go ahead and walk to the door and back for me. Alright, good. Balance is good. Now just go ahead and walk heel to toe to the door, and then you can just walk back normal. Good, no problems there. Alright, now we're going to have you do some balance, okay? So you're going to go ahead and put your arms out for me. You're going to close your eyes and stand on one foot. Good. Go ahead and do it the other side too. Good. Okay. Balance is intact. Alright, last thing, Joel, you're just going to do the range of motion of your spine, so go ahead and just lean over for me. Good, and then lean back and arch your back. Good, and back up, and then go side to side. And then twist. Good. Any pain or discomfort there?
No.
Alright, well, thank you, Joel. That's the end of your health assessment.